If you can hear my voice, clap your hands once. If you hear my voice, clap your hands twice. Thank you. Thank you for the applause. I'm just kidding. So we hope this has stimulated you to be thinking about what does it look like to have communities that are dynamic and creating solutions together. Our goal, this is just the midpoint of this entire day workshop, isn't for us to have the answers, but for you to begin to have questions. And so one of the things we'd love is for you to question, each of you, the elements of this that really resonate with you from your experience, that you saw were true in the stories that of the two communities that were just happened to be the two communities that ended up being available and able to come today. What did you learn from those, and from your past experience? And on the back, to add in questions that are sort of circling around in your mind about what it looks like to really do this work. And so, does that make sense? So we're going to collect those. It doesn't have to be a big something that you agree on as a table. Just you individually are asked to do this, and those questions will become part of how we think about and grow in this kind of learning together. And then finally, I'd like to invite the communities back up, Tenderloin and Algoma, and we'd like to take some questions and any major insights that you had as you were reflecting on this.
So I'm George Eish, I'm also co-chair. So the directions are, write down on the back of your paper the questions you have. And secondly, circle the bullets that you think are the highlight. And we're going to collect that and make a report of it. So please do that as we then now have the communities come back and have the questions.
People are worried about yes, so do it on this. It's actually going to be part of the resources that are sent out after the roundtable. And I'll make sure all of the 100 million teams have it as well. This is part of our collective synthesis. All right. So either insights and questions for the communities. We have a question in the back.
Hi. So one question that came up for our group in a couple of different ways is, how is community defined? Is it geographic, demographic? How broad is it? How small? Things like that.
Yeah, Pete, this is a good one. In our work, or at least my feeling on that is, community can be defined in many different ways. I talked about a community that was created around getting disabled individuals involved in athletic activities. That's a community. An inner city school, to me, is a community. Teal and I presented with Sweden and Scotland earlier in the week. They're dealing at the whole country level. That's their community. So what is the population, I guess, that we're trying to bring together to accomplish a purpose or an aim, create vision and passion around? So I'm pretty liberal with how a company, we work with companies in creating community within companies. That's just my personal definition. So it can be very micro, I guess, all the way up to macro, an entire country.
I think for us too, it's been, it's an organic thing. Community, it's human based, so it can be flexible. Sometimes people identify with the community, and sometimes that changes. I think for the purposes of our work and for grant funding purposes, we've defined it as sort of neighborhood based. And again, that gets complicated because that could be zip code, that could be certain streets. So there's even some flexibility within that. And I know at some point we had a really important and thoughtful conversation about, when we talked about residents of the Tenderloin, if that included people who are unhoused in our community, which it of course does. But that was a very important point to sort of discuss as a community as well.
we say there are two kinds of communities. There's network communities, which is a group of people that have something in common, and place-based communities that are places that have a set of structures, systems, and functions that are operating within them. And often you are working with a group of people who are in the context of a place. And so what matters is actually just to know which you're talking about and to understand how they interact with one another.
Do I need the mic? I'm not sure if I do. Brian Rawson, thank you for the panel. Our table was grappling with kind of reconciling this presentation with the previous one, and my question arises out of that. It seemed this conversation was largely about once people come together, how do you facilitate a positive, solution-oriented kind of collective impact conversation, very process-oriented. And I'm curious whether you, in order to have that conversation flow, do you need to address some of the things that were raised in the previous panel, such as do people come to the table feeling like they're not fully recognized, or they're sort of seen as dehumanized, or they're viewed as the problem that they are supposed to change? Do you have people feeling as though if you're not sort of bluntly naming root causes, systemic racism and other things, that if you're not being upfront about naming some of those things, that the conversation is too superficial? I'm just curious, how do you need to address some of those things to arrive at a space where that productive collective impact conversation can succeed?
So you can talk to, I would say, going back to that framework of leading from within together, there are certain tools that we've been learning through Scale, IHI, about how we lead from within. You have to lead from within first before you can formally come together with others. So this isn't just, we get people together and it's fine and dandy and everything is clean cut. We really have to talk about our own implicit biases. So where do we stand? What questions do we have? What privileges do we have? And we need to address those within ourselves first. And then we use a set of tools that was offered by Scale to help other people build their capacities and the language. Language matters. People need the language in order to talk about what it is that, what they're dealing with inside from within. So I would say it's about by yourself, and then when you get them together, it's going to take time. At first, you're going to see the power in the room, and that's natural. And then you need to work through that together as a team. At our table, Andrea was asked a very similar question to that, and it's about building the capacity of our key stakeholders in our community, and building our capacity of our community members with lived experience. It's both. They both need to build their capacity of how to have that conversation.
I actually thought there were a lot of similarities. As I listened this morning, I heard people understanding their communities and the dynamics and what makes the community that they were talking about. I heard driving social movement, really creating a social movement to at a grassroots level. I heard critical conversations. I heard co-creation. I didn't know that I heard a lot about spread and scale, but for me, as I put that lens on, I actually thought the conversations were extremely similar and not dissimilar. Maybe told in a little different way, but I could put it through my lens and say we were talking about very common sorts of things.
And I would just add that absolutely that those conversations are a vital part of the work that we do. I come at this as, with a funding background, as a funder, with a hospital, certain amount of privilege, and we're not doing direct community services in the way, so the language may be a little bit different, but if we're not hearing discussions around structural racism and who has power in our community, then I don't think we have the right people at the table. So we do hear that stuff. We do hear that language all the time, and it's part of our language as well. It really depends on the context. I heard somebody use the term code switching, and that can really sort of mean like who's your audience and how do you communicate in a way that's going to really resonate with them in that space.
Some of the tools so in the very first Leadership Academy, people actually, one of the things we do is teach a lot of skills that help create conversation, that create safe space. So one of the first things that people do is they'll actually start by introducing themselves to one another with the story of their name, the story of their community, and the story of their gifts. And then they go on to do things like habits of the heart, which is on the back of the collaboration page, that the touchstones for collaboration page that Will handed out to you guys, which starts with an understanding that we're all in this together, an appreciation of the value of otherness, an ability to hold tension in life-giving ways, just as an example. And then actually invite people to take walks where they share each other's stories with one another and describe and actually know each other's history and what has broken them and what are times that they've failed forward and what are times that have just lifted their hearts. So it's actually beginning to create those conversations from a place of human interconnectedness. And then by the time they actually go out, one of their first tasks is to learn and to actually build a plan for engagement of different people. And we say there are at least 3 groups of people that need to be on the team together solving a problem. There have to be the people who are sort of the system leaders, who'll think in the way system leaders do. There have to be the community connectors who, and we say, you all know who she is. She's the one who in the background is really getting everything done. And then you have to have the people with lived experience. And we say that actually the vast majority of the solutions actually reside in the insights of the people with lived experience. And a part of that first Chila training is how do you set the table, and how do you prepare for the voice of that lived experience to actually come in, to be heard, to gain confidence so that it can actually be a meaningful way of contributing solutions to the community. But it's absolutely, and then as we get deeper and deeper by Chila 3, when we build trust, we talk about the isms. You have Natalie Burke talking very explicitly about power, about privilege, but we help people get there in a process that helps build trust and community and a sense of common vision together and continues to grow who's in the room over time. It's not, because it's not a static process, you continually get to keep building who is in the room and how their perspectives help create the solutions. And one, yes.
I wanted to follow up on this. It continues this conversation, and we were having this conversation with Pete when he was called back up to the front. So I wanted to ask this question. We all, as public health people, we all come to the situation with our own prejudices and beliefs. And that I was wondering about how you interface that with communities. And just the example I was asking Pete about is, suppose that you go to a community and that it's a very prevalent belief in the community that the way to have long lives and safe lives in that community is for everybody to have an assault weapon in their home to protect against bad people. Or that that really what you need to do is get government off our backs so that I can ride my motorcycle without a helmet or smoke cigarettes when I feel like it. What do you do if you confront a community like that? I presume there are some communities like that out there.
Again, I feel like you can't go into the community that you're defining with the answer to it. So you have to meet people where they're at and why it is that they have that belief. Once we go in and say, well, I hear what you're saying, but it's really not the way. You can't be doing that on a motorcycle. That's the law. I mean, they're not going to have a shared voice at the table. And so until we kind of break that down and just really come to the table and organically listen to each other of why they're saying that, I think it has to you have to come to the table not with an answer and not a way to fix it. You have to meet them where they're at. There's a reason why they feel that way.
And I would add, to echo on the power of listening and not coming in with assumptions and answers, and to be present in that moment. One of our fail forward stories early on developing TL HIP was we were going to have this structure. We have a building on the needs assessment. We would go in and say, we've got a lot of money, come play with us, and that would unearth all these solutions. And that process in itself yielded a lot of disparate ideas, and it failed. And so we tackle it now really looking at where community is at and where they see the solutions that they're living every day. So really coming in as a co-creator and a supporter and a cheerleader is where we've seen our role evolved.
In the Tenderloin, we don't exactly have those beliefs that you presented as examples, but we do have in our community a very clear public injection of drugs issue. And we've held a number of different conversations with folks who are businesses, with people who are active drug users, people in public health department who have strong harm reduction philosophies. And you know, it's a really difficult conversation. That whole we're now at a place where we've actually got common recommendations and agreements on potential solutions. That whole process took about 1.5 to 2 years. And you know, I think people had to give a little bit of that belief system that they held so dearly in order to hear the other side of the situation. And there are people who I think were very, very on one side in terms of thinking, you know, something, and then now they're clearly on the other side. Or they found common ground. So, you know, it's an evolution of the way that you think. But I think, you know, understanding the humanity in people is critical in being able to find some common ground.
I think some of what we've learned is that actually they won't change anyway, like in taking a different approach. And part of creating context where we actually set up from the beginning, the idea that everyone holds a piece of the puzzle. We need to understand one another. Actually, improvement thinking, which is where let's try that out. Let's actually look at the data. Let's imagine that it's possible. And so let's learn together what it is. And then stories, I think, are crucial. And this is where, I mean, whether it's kids telling those stories or the stories of real people in real neighborhoods, we have a ton of communities now in 100 million who are in states that you wouldn't think of as places that are focusing on health equity, and yet they're mayors, county commissioners, others who have absolutely decided to put health equity forward. And they're doing it in their own way, using their own tools and their own assets of how they come together in community to do it. But some of those efforts are absolutely breathtaking to behold. They have different language around it. They won't adopt exactly the same language that we write, but so much of it is actually taking it down to underneath that language. What are the real principles of understanding that we're interconnected, that our fate is related to one another, that we want to be a place which is fair, that everyone has the ability to reach their full health potential. And it's been amazing what people have been willing to give up in the context of feeling like they're owners in creating the well-being of their neighborhoods, of their families, of everybody, in people that they know and touch, as opposed to just policy issues.
So I'm Bridget Kelly with the new organization, Bridging Health and Community. And there's 2 themes that came out of our table that I wanted to convey. One is something that felt dissonant to us, actually, between the way both panels describe their work and the way it's articulated on the page, which is those 3 groups you talked about: people with lived experience, community connectors, and formal leaders. And that was a little troubling to us because really everyone who's involved in these relationships has a lived experience that they're bringing to the relationship. And so it seems like that's not an us and them thing. That's a really core to everyone who's participating. And it also implies that the people that you're having in that lived experience, who might be residents and community members in different roles outside of health, are excluded from pathways that would make them be participants in formal systems change, in addition to sort of providing insight into systems change. So that was something we thought would be worth thinking about in this. And then we talked a little bit about what meaningful outcomes means and how it relates to the idea of having a dynamic process, and that the dynamic process itself potentially needs to be the outcome, that you need to be able to demonstrate that you've had a shift in the power dynamics, that the people who hold the power and the resources are willing to change what they see as important, and that the healthy struggle itself is happening, is a meaningful outcome. So that was a reflection on, as opposed to just some metrics and indicators being the most important outcome.
Yeah, we would agree, and we would say there's a metric on that. And so
there's a way to measure it, even if there isn't a metric.
Yeah, there's a way to measure it. That's right. Yeah. And actually part of what we actually said, we're not going to define any outcomes. It's actually communities will define what matters to them. They actually have a metrics database that we built that it's called Measure What Matters, where they get to actually choose what those things are. And so the 6th graders whether they're choosing the ugly fruits and vegetables metric, that's their metric because that's what they care about, that's what it's called. Or whether it's somebody talking about community engagement and people feeling safe, or whatever that is for them that matters. It's the idea that people get to define it. And I think your comment about language is really important. And we absolutely will take that and think about that. I think part of what we wanted to say is that often we treat community members as people to go to, ask what their needs are, and don't treat them as part of creating the solution. And we wanted to honor the experience that they have about what the solutions were. But I think you're right that it can create a false separation in not recognizing others. So thank you for that feedback.
It was interesting because I agree wholeheartedly. I still think in healthcare we're trying to apply our metrics onto community. And the only way this is successful, I think, is for the community to define what's important to them and then to set up the measurement. And I think a great example, I was on the phone a couple of months ago. It was a large city and it was a health system, and they were talking about and lamenting about the fact that some of their quality metrics were lower in the lower income neighborhoods, and they couldn't figure that out, and it was really bothering them, and they were trying to launch initiatives to improve the quality metrics within neighborhoods. And then finally I said, it's probably first a matter in those neighborhoods of hope, and we need to build hope for a better future, and the metrics will come if that can happen. So it's what we lead with sometimes is misaligned with what's important and what are the real issues of that community.
I have an example in Algoma about that. When we started the scale work, we were asked to define what it is, what we were going to work on. And we're not a nonprofit. Everybody who comes to the table is from different systems or our community members. And we looked at our data and we said, okay, obesity, that's pretty high in our community. Let's do something about that, and let's do something about this. And at the end of the day, we were like, what is it that our community really wants? I mean, we could say that they want to work on the obesity rates, but that doesn't necessarily mean that's what they want to work on. And so as we started to partner with our community members, they were the ones that created the driver diagrams and aims within our community. It wasn't the people that started this with scale. It was our community members. And through time, I think Pete and I were just talking about this week in Florida, but our community has found that we have a dream deficit in our community, especially in our youth. They can't even fathom some of these possibilities that they have in their future. And that's something that we need to really, I guess, put our flag in as a community and address that.
We've reached time here, and I'd like to thank the panel very, very much and encourage any of you that have questions remaining to please write them down or approach the panelists yourself. I'm sure they'd be glad to answer your questions. But thank you very much for an excellent, excellent presentation. I have a couple of announcements about logistics. One is that there are a number of handouts on the back table, case studies, examples, models, summaries. Please help yourself to the copies that are there. The people that have brought them wanted to make sure you availed yourself of those. Second thing is that we're running late. You're probably all very hungry, and as well as I am too, and we want to have a nice lunch. We have set aside 45 minutes for that. That means we'd come back and be ready to start at 1:30. So I'm going to ask all of you to come back here at 1:20 and ready so that we can settle down after you've gathered your things together and we can start at 1:30. But I'd also like to ask, because our panels have been going long and we've had excellent questions throughout the day, how many of you absolutely need to leave at 5 p.m. because that's the scheduled time here? We'd like to know how many will we lose after 5. Please raise your hands up. I want to see how much of the audience needs to go. Okay, so there's a good number of you. We're going to try as much as we can to keep to the schedule and to end as close to 5 as possible. But we'll have to watch our our time and our speakers' times very carefully. So help us do that. Thank you very much for a great morning session, and we'll see you at 1:25.